Subscribe to the Global War Archive right now, because what you're about to hear isn't folklore dressed up as history. This is a serious look at how ancient people confronted pain, injury, and disease with methods that were often brutally practical and in many cases shockingly effective. If you've ever wondered how soldiers, laborers, and ordinary civilians survived fractures, infections, and chronic pain long before modern medicine, stay with me. The ancient world did not have anesthesia, antibiotics, or sterile operating rooms, yet it produced systems of healing refined through trial, failure, and survival pressure. What matters here is not romance or mysticism, but function. These methods worked often enough to be passed down, written about, and standardized, and some still underpin modern medicine today. Ancient healers understood pain as both a physical and functional problem, not just something to be endured. In places like ancient Egypt and ancient Mesopotamia, medical texts show that pain relief was inseparable from healing itself. Wounds were cleaned, bandaged, and treated with substances chosen for their real-world effects. Honey, for example, was not used symbolically. Its antibacterial properties made it ideal for open wounds. Even today, medical-grade honey is used in wound care. A modern survivalist can apply this knowledge by understanding that raw, uncontaminated honey can slow infection when no antibiotics are available, provided the wound is first cleaned thoroughly. Plant-based analgesia formed the backbone of ancient pain management. Willow bark, rich in salicin, was widely used across Europe and parts of Asia to reduce pain and inflammation. This is not coincidence, but chemistry. Salicin is the natural precursor to aspirin. Hippocrates documented its use centuries before synthetic drugs existed. The lesson here is precision. Ancient healers learned which plants dulled pain and which were dangerous through accumulated experience. For practical application today, this means understanding dosage and preparation. Willow bark was dried, steeped, and consumed as a tea, not eaten raw in excess. Knowledge, not desperation, made it effective. Opium poppy cultivation represents one of the most powerful ancient breakthroughs in pain relief. In the Eastern Mediterranean, physicians under Galen used opium sparingly for severe pain, trauma, and surgery. They understood its dangers, even if they lacked modern pharmacology. Opium was diluted, combined with other herbs, and administered in controlled amounts. The key takeaway is restraint. Ancient medicine worked best when practitioners respected limits. For a modern reader, this reinforces a survival principle. Powerful remedies demand discipline, not improvisation. Cold and heat therapy were, well, pretty much universal because they were reliable. Ancient Greek and Roman doctors, for instance, prescribed cold water immersion for swelling and acute injuries, while heat was used to relax muscles and improve circulation. Soldiers, returning from battle, often had their limbs immersed in cold streams to reduce inflammation. And this is actually actionable knowledge today. In a low-resource environment, cold exposure can reduce swelling in sprains, while heated stones wrapped in cloth can relieve muscle stiffness. These methods persist because they work, not just because they are ancient. Surgical pain management without anesthesia is really where ancient ingenuity becomes, well, uncomfortable, but honestly quite impressive. Alcohol, mandrake, and henbane were used as sedatives, particularly in Roman and later medieval contexts. Dioscorides described mixtures that induced sleep or dulled awareness during procedures. These were by no means perfect solutions, but they reduced shock and allowed life-saving interventions. The practical lesson here is that ancient medicine prioritized outcome over comfort. Pain was managed to the extent necessary to keep the patient alive and functional. Pressure and manual techniques were also critical. Ancient Chinese and Indian medical traditions recognized that pressing specific points could reduce pain. While they lacked modern neurological explanations, They observed consistent results. This knowledge survives today in acupressure and massage therapy. For practical use, learning how sustained pressure can interrupt pain signals or relax tense muscle groups is valuable in any survival or field medicine context. Infection control was the silent partner of pain relief. Pain worsens when infection sets in, and ancient healers knew this empirically. Wine, vinegar, and herbal washes were used to clean wounds. Roman military medicine standardized these practices because infected soldiers were useless soldiers. Cleaning wounds thoroughly before applying any treatment reduced pain over time by preventing complications. This is a lesson still relevant. Pain relief is not just about numbing sensation, but eliminating its cause. What separates effective ancient healing from superstition is documentation and repetition. Methods that failed disappeared. Those that worked spread across cultures. Pain relief was not about comfort alone, but about restoring function. Farmers needed to work, soldiers needed to fight, and societies depended on people returning to usefulness quickly. If you value this kind of grounded, evidence-driven history, subscribe to the Global War Archive, share this video with fellow historians and survival-minded thinkers, and keep these lessons alive. The ancient world still has practical knowledge to offer if we're serious enough to study it.